Welcome for the today's topic, compliance. This topic is a topic of quality assurance subject. The contents of this topic includes complaints and evaluation of complaints, need for complaint and handling system, returned goods, classification of returned goods, handling of returned goods, recalling, waste disposal. Coming to the complaints, the definition of complaint is defined as a statement that is something wrong or not good enough, which shows customer dissatisfaction about the company and the product. Complaint about a product is an indicator of the product quality and also about the expectation of the consumer from the product. Any product complaint should always be considered as a feedback, and this information should be used for improving the product quality and related manufacturing operational systems. A procedure must therefore exist to channel complaint reports appropriately, otherwise, a complaint or adverse event may lead to the need for recall. All complaints and other information concerning defective products must be carefully reviewed according to detailed written standard operating procedures, and detailed records must be kept and used for further improvement and elimination of defect in product. Need for complaint handling system. It gives the company an opportunity to improve the quality of the product. It is helpful to maintain CGMP. It maintains committed relationship between the customer and company. It is the regulatory obligation. Coming to the evaluation of complaints, regulatory literature provides the following guidelines. A standard operating procedure should be available giving full details about how to handle products complaints and necessary records about complaints. A person should be designated for handling the complaints and deciding the measures to be taken together with sufficient supporting staff to assist him. If a product defect is suspected in a batch, other batches should also be checked in order to determine whether they are also affected. All decisions and measures taken as a result of complaint should be recorded and referenced to the corresponding batch records. A file regarding such drug products complaint shall be maintained at the factory where the drug product involved was manufactured, processed, or packed. Written records involving a drug product shall be maintained for at least 1 year after the expiration date of the drug product. Such written records shall include the following information: name and strength of the drug product, lot or control or batch number, name of the complaint, name of the nature of the complaint, reply to the complaint, if investigation is made, its complete report. Where an investigation is not conducted, the written record shall include the reason that the investigation was found not to be necessary and the name of the responsible person making such a determination. Compliant records shall be regularly reviewed for any indication of specific recurring problems requiring attention and possibly the recall of the marketed product. All decisions and measures taken as a result of a complaint should be recorded and referenced in the corresponding batch records. Trend analysis should be performed in an event to identify possible recurrent causes leading to a negative effect on a product. Next part of this topic is returned goods. Pharmaceutical products can be returned from market for various reasons, problems, accidental damage of goods, etc. Such products when returned from market should have the following action immediately taken on it. Physically examine the condition of the returned goods returned. Also check all the relevant documents. Ask QC department to evaluate the quality of the goods received and take a decision on whether these products can be reprocessed, recovered, or need to be destroyed. If it is possible to reprocess and recover, then such products after reprocessing or retesting may be considered for relabeling, repacking, and reselling the same. QC department should evaluate all aspects of the received material, wherein even a slightest doubt arises about the quality of the product, it should not be considered suitable for reissue or reuse. Any action taken should be recorded. Coming to the classification of returned goods received by the company at any of its warehouse may be classified in relation to the primary cause of necessitating their cause. Date of expired products, damaged or broken primary containers, leaky or broken seals of closures of primary containers, smudged labels rendering to the products unidentifiable as to their name or batch number, soiled labels rendering to the product aesthetically unpresentable but otherwise clearly identifiable, products recalled voluntarily by the company, products recalled as per directives from drugs control authorities. Coming to the handling of returned goods, SOP. Purpose of SOP. to lay down systematic procedure to establish handling of returned material or products from the market. Scope: this method is applicable for the handling of returned material or products from the market. Responsibility: production head or technical director or head quality assurance or the responsible personnel. Accountability: head quality assurance. Procedure: any material or goods, that is finished products and or intermediates, returned from the market shall be stored in a separate area dedicated for storage of returned goods. Record all the details in return goods record in the format. Inform the quality assurance department for evaluation of the returned goods. The quality assurance chemist shall evaluate the returned goods for the following: check the certificate of analysis and other documents with the returned consignment, condition of the packaging, carton and container, labeling details. If the returned material has exceeded the labeled expiry period or the condition of the packaging, carton, container and storage conditions of the material before returning or shipping are doubtful, and then destroy the material as per the SOP for controlled sample destruction. If none of the above condition is apparent, then sample the material as per the SOP for sampling of the finished good. Analyze the sample as per the current approved product specification. If the product meets appropriate product specification, then the returned product may be considered for reprocessing as per the SOP for reprocessing, provided the subsequent product meets the product specification. In case the sample fails to meet the product specification, destroy the material or product as per the SOP for destruction and initiate failure investigation. Identify the batches manufactured during the same period and or manufactured by using the same raw materials and extend the investigation to these batches also. Next part of this chapter is the recalling. Definition of recall. Recall means a firm's removal of a marketed product that the Food and Drug Administration considers to be in violation of the laws it administers and against which the agency would initiate legal action. Objectives of recall: stop the distribution and sale of the affected product, effectively notify management, customers and regulatory authority, efficiently remove the affected product from the marketplace, warehouse and or distribution areas. Dispose and conduct a root cause analysis and report the effectiveness and outcome of the recall. Implement a corrective action plan to prevent another recall. Recall classification. FDA classified the product recall depending on the health hazard caused by the product. Class 1 is a situation in which there is a reasonable probability that the use of or exposure to a violative product will cause serious adverse health consequences or death. Class 2 is a situation in which use of or exposure to a violative product may cause temporary or medically reversible adverse health consequences. Class 3 is a situation in which use of or exposure to a violative product is not likely to cause adverse health consequences. Coming to the recall procedure, any employee becoming aware of such medicine or any adverse event related to it should immediately notify to higher authorities. Immediately quarantine existing in-house of relevant medicine. Record the following information: the product name, strength, pack size, batch number, manufacturing date and expiry date, the total number of units released for sale, date on which distribution commenced, total number of units distributed, number of units still in stock, nature of reported violation. In the light of above information, higher officials evaluate the health hazard presented by the violation medicine and documents it on medicine recall control document. This is the format of the medicine recall control document. All the contents need to be thoroughly and completely filled and investigated. Formulating a proposed recall strategy. It specifies the nature of communication to be used either through phone, fax, telegram, letters, etc., as well as the level in the distribution chain to which recall is extended to wholesalers, retailers, public, etc. Relevant records shall be submitted to regulatory authorities with proposed plan of action. The GM, QA, QC, regulatory or GM manufacturing implements recall without delay. They also prepare an interim reconciliation report after 30 days and submit a copy to concerned authorities. After that, a report of final reconciliation after 90 days is prepared and a copy is submitted for verification, and steps should be taken to prevent the recurrence. Prior to completion of recall, the following points should be considered: method of destruction of the product, a designed area to receive returned medicines, inventory of medicine, destruction authorization. The recall will be terminated when the QA, QC, regulatory or GM manufacturing are assured that recall has been completed reasonably and a medicine record status report is completed. GM QA/QC, regulatory or GM manufacturing shall prepare a standardized recall letter and press statement. After the authorization by GM QA/QC, regulatory or GM manufacturing, the recalled material along with stock in hand shall be destroyed, and that should be recorded. This is the format of medicine record status report. Next part of this topic is waste disposal. There should be a written authorized procedures for handling, destruction and disposal of all rejects. Waste generated during production or handling of pharmaceutical product and printed packaging products. All rejects or waste should be collected in suitable closed containers, labeled appropriately and held in segregated space until taken for destruction. Destruction must be carried out by authorized persons under the supervision of responsible person. Quantities rejected and destroyed must be recorded and reconciled in relevant batch document. Appropriate safety precautions must be taken while carrying out destruction. Final disposal of residual solids or liquids should be consistent with regulatory requirements, including environmental impact. Reference: Sanjay A.N., Mayur R.B., Rajiv M.U., Krishna R.G., a textbook of pharmaceutical quality assurance, Jalandhar, Punjab, 2019. Thank you.